Welcome to the foundational concepts of One Health. I'm Vijay Yaldandi. I'm an infectious disease clinician specializing in transplant infectious diseases and also public health. For the last 3 decades, I have been working in the United States as well as India. In these sessions, I would like to introduce to you some concepts that I think have broad applications in health. So please join us as we explore these series of foundational concepts of One Health. Part 1 discusses salutogenesis. Salutogenesis requires a sense of coherence that has 3 components in it: comprehension, capacity, and capability. In another session, we have already discussed comprehension. In this session, we will be talking about capacity. Capacity relates to the ability to cope with the condition. In the context of health, it is the health condition that we will be discussing. Let me give you an example of an experience of mine many years ago. I had been seeing the same patient repeatedly coming into the hospital every few weeks with the same problem. This was an elderly lady, and her blood sugars were wildly out of control. Once again, she required intensive treatment in the hospital. The insulin regimen was intensive, lots of IV fluids, and then, as usual, she was preparing to go home until I stopped my residents and I asked them, why is she coming again and again and again? What are we doing here? It turned out, as I reviewed the records from all of her admissions, that every time she would come into the hospital, we would give her the best treatment. Well, the best treatment meant the latest and the best kind of insulin, and that was rather expensive. This lady was given instructions to go home and use the same kind of insulin. Well, it turns out she was an elderly lady on a fixed income, and by the time she had paid for her rent and other fixed expenses, she had almost no money left for medications. So she took what was prescribed to her for a few days and then ran out of money and ran out of her prescriptions and then landed right back into the hospital with the same problem. And I had to stop, and I said, now let's sit down and have a little talk about what this lady can do and not do. What is practical for her? Is it necessary for her to really have the best and the most expensive form of insulin? Or can we come up with another practical regimen with a less expensive form of insulin that this lady can really afford? And after a little while, it became abundantly clear that that was possible. Not only that, as we recruited some of our family members and friends, they all agreed to pitch in and help her out with the expenses of her medications. Well, the story has a good ending. This lady had much better control of her diabetes at home and did not require to be put back into the hospital again and again. This is a very simple example of what we mean by thinking about capacity, which is the ability to cope with the health condition. Now, the ability to cope with the health condition obviously requires comprehension. That person really should understand the nature of the problem and how to tackle it. Knowledge is power. But at the same time, very often, there are a lot of other resources that must be called in. The support of family and friends, economic resources. Can the individual really afford the kind of medical regimens that we would like to prescribe? Is there a way to actually build an understanding, a shared vision, a partnership, to design a regimen that is practical, that is affordable, and that is possible for everybody concerned to really do well at home? What is the home condition like? How is this person placed in terms of accessing healthcare resources? How far away is the healthcare provider? All of these issues go into the capacity of anybody to cope with the health condition. For the formation of health, for salutogenesis, capacity becomes an essential component that, combined with comprehension, leads to the ability of anybody to have a better outcome. So I hope that you will think about the capacity whenever you are thinking about partnering as a healthcare provider to help somebody have a better health outcome.